Okay, we're going to start and let people start to come in as they will. So welcome to the Nutrition as a Treatment for TGCT Inflammatory Symptoms. During this seminar, our participants will be on a listen-only mode. There will be a question and answer session at the end of the presentation using questions submitted through our Q&A feature. Please remember this information provided by this web seminar is not intended as a substitute for your physician's guidance and care. My name is Sydney Stern, and I'm the Director of Giant Cell Tumor Programs, and I am your moderator for today. We would like to thank our sponsors today, Daiichi Sankyo and Deciphera Pharmaceuticals. Before I introduce our presenter, I'd like to take a moment of tribute to Caitlin Coleman, a giant cell tumor patient who lost her battle after malignant transformation. This disease impacts us all very differently, but for Caitlin, it took her life. A bit of her obituary was written by her family, and I'd like to read a little bit of it. So Caitlin would want us to remember her with a smile, including her dimples, rather than with tears. She would want us to find comfort in knowing she is free from pain and home with her Heavenly Father, as well as her family gone before her, especially her baby sister, Lauren. Caitlin will continue to bring sunshine into our lives, and we will miss her witty sense of humor, her contagious smile, her love of life, and her innocent nature. She will be deeply loved forever and will never be forgotten. She was literally one in a gazillion special kind of person, they said. Caitlin is survived by her parents, Michael and Stephanie Coleman of Princeton, Texas, siblings Connor Coleman, Mason Coleman, Heather Coleman, niece Ashley, Aunt Candace, Uncle Carrie, cousins Christian and Adian, sister-in-law Kelsey, and her boyfriend Bryce. Thank you all, and now I would like to introduce our presenter today. So Kenny Gleissner, he's an RD. He's a registered dietitian currently working in a clinical setting in a long-term acute care hospital in Columbia, Missouri. Additionally, he works as a dietitian in an inpatient psychiatric hospital where he provides nutritional assessment and teaches nutrition classes. Previously, Gleissner worked as an inpatient oncology clinical dietitian at the University of Maryland Medical Center, where he assured patients and met with their nutritional needs throughout chemotherapy and hospital admissions as part of their medical team. So as a registered dietitian, he strives to help people understand nutrition and how it impacts them specifically, while educating people with sound nutritional advice using only evidence based on scientific research. So, also, I don't know why it didn't change. Sorry, it's Caitlin's picture for all that didn't get to know her. And so I will let Kenny start sharing his presentation.
All righty. Thanks, Sydney, for that introduction. Thanks, everybody, for joining us here. Let me pull up my slide. Okay, does that look okay? Okay. All right, so I'm excited to talk to you today about nutrition as a treatment for TGCT inflammatory symptoms. So here are some of the topics we'll talk about. So we'll talk about kind of the science background behind inflammation and how nutrition plays a role in that. We'll talk about some tips with nutrition for managing specific symptoms and overall inflammation. We're going to talk about antioxidants and what are antioxidants and what do they do for our health. We'll also talk about the differences between anti-inflammatory diets versus pro-inflammatory diets. And then, tips at the end for how can you make your diet anti-inflammatory. All right, so basically, this is what inflammation is. So here's the definition. So it's a local response to cellular injury that is marked by capillary dilation, leukocytic infiltration, redness, heat, and pain that serves as a mechanism initiating the elimination of noxious agents and of damaged tissue. So basically, it's a body's defense mechanism for insults. So one of these things that we talk about with inflammation is free radicals. So these are molecules, they're unstable molecules, that are formed in everyday life, after exercise, after exposure to environmental pollution, when we break down our food, we develop these free radicals. So your body's, fighting these on a normal basis. Too much can cause oxidative stress, damage cells and chronic illness. So it's something that needs to be managed all the time. So some of the common symptoms of inflammation of TGCT are, different signs that you would consider with inflammation, like redness, swelling, heat, pain, and loss of function. So let's talk about the nutrition part of managing inflammation. So this is a little more science background of, how we deal with free radicals. So we're looking at, a very tiny free radical. So basically, this is a very tiny molecule that has what's called an unpaired electron. So these are little negatively charged particles that go around and kind of cause these damages to other cells. So this is what we're trying to, kind of stabilize. And that's where antioxidants come in. They're kind of like the, like the guard or the police, just keeping the peace. So they are unique substances that stabilize these free radicals. So antioxidant is actually like an action. So it's a chemical property. So, drugs can act as antioxidants. Obviously nutrition can act as antioxidants. And, our body, naturally has antioxidants to combat these free radicals. So there are likely thousands of things that act as antioxidants, and we'll talk about the nutrition piece of that. And because antioxidants are unique, one can't perform the job of all. So we'll look at that. One can't just eat vitamin C and just call it a day, and that would take care of all the inflammation or do the job of all. So we'll look at why that's important in nutrition. So I just wanted to show this because it's kind of interesting how popular antioxidants have become over the past century. Between the 50s, 60s, nutrition and vitamins and minerals were being studied and becoming, more prominent. And as we see, closer to 2018, 2019, really hit a peak for antioxidants. So they must be, really important for us. So we'll kind of look at, why they're so great. So here's some antioxidants that you probably have already encountered and, are more familiar with. So things like vitamins, vitamin C, vitamin E, beta carotene, also known as vitamin A, primarily found beta carotene in like vegetables and plants, and two minerals like selenium and manganese. These all act as antioxidants and help fight off these the free radicals. Another thing that acts as antioxidants that we're starting to learn more about are called phytonutrients, and that pretty much translates into plant nutrients. And as we can see, plants come in all different sizes and shapes and colors, and the nutrients kind of align with certain colors, and we'll kind of look at that. So here's just a couple phytonutrients. There are thousands pretty much of phytonutrients that we're starting to discover and learn about. One being beta carotene. So like we talked about vitamin A, and these are found in your orange veggies and your leafy green veggies. Things like carrots, sweet potatoes, pumpkins, squash, cantaloupe, spinach, kale, broccoli. Lycopene. First thing when I say lycopene, I think of tomatoes. Tomatoes are a good source of lycopene. Watermelon, red peppers, pink grapefruit, they're all sources of this phytonutrient. Anthocyanidins, so a lot of your berries. So think of your blueberries, blackberries, plums, cranberries, and also raspberries, strawberries. If we look at isoflavones, so these are found in like your soybeans, tofu, other like beans, legumes. Lutein, so these are found, so these are related to beta carotene, and these are found in egg yolks, broccoli, spinach, kale, orange pepper, grapes, orange juice, zucchini, squash. and resveratrol, which is primarily found in, grapes and wine and peanuts and cocoa. So as you can see, there are a wide variety. This is just a few of them of phytonutrients, and some of the foods kind of overlap and have multiple antioxidants in them. So let's talk about, some of the foods that have antioxidants. So some other foods. So cruciferous veggies, so, like your broccoli and your cauliflower. There was a study that had about 1,000 Chinese women, which found that the more cruciferous veggies they ate, the lower levels of inflammation or signs of inflammation that they had in the blood. So that's pretty promising. Cherries are another good source of antioxidants. They have polyphenols, which are, like another type of, like a subgroup of these phytonutrients. And vitamin C, which we talked about being an antioxidant. So they found that when they were eating cherries, this actually decreased the markers of oxidative stress in 8 of 10 studies. So this was a study looking at a number of studies. So a lot of these studies found less oxidative stress, so less inflammation in the body, and specifically inflammation decreased in 11 of 16 studies. So that's really interesting. But I do want to note, for this study, or for most of these studies, participants had to eat about 45 to 270 cherries in a day. So it's kind of dose dependent there. So that's a lot of cherries you have to eat in a day to see these results. And also the studies were relatively short, about a week or two in duration. But pretty promising that eating cherries can have an effect of antioxidants. Just to name a couple other foods, dark chocolate's a really good source of antioxidants, coffee, mushrooms, red wine, like we talked about, the resveratrol, that's the primary antioxidant there, the name of that, green tea, and ginger. So how much antioxidant should we be eating in a day? Well, for things like, vitamin C, vitamin A, we know these things in terms of what somebody should eat in a day. If you look on the right, the nutrition label, you can see the percent daily value. That's basically, how much of this particular food item gives you of that nutrient. So we know it for vitamin D, we know it for iron, calcium, potassium, and all the other nutrients. But antioxidants, we're learning. These phytonutrients, they're kind of a newer territory for nutrition. So research is often conducted with animals, particularly mice. So it's really hard to make assessment for what humans need to eat. So there aren't any recommended daily values for some of these other phytonutrients like lycopene, the lutein. So we don't really know yet. We don't know if there's a benefit to having, a certain number in a day or not. So we're still trying to figure that out with some research to back it up. So just as a general guideline, which I'll kind of touch on this throughout, is a generally healthy diet with a variety of these antioxidants foods is pretty key for managing inflammation. All right, so we will talk about one of the symptoms, pain, and how to manage that with some of the nutrition pieces. So people with chronic pain, have elevated levels of these pro-inflammatory cytokines, or these signaling molecules in the blood. So variable increases, we found, of blood sugar can contribute to stress on the body and low-grade inflammation in both acute and chronic pain. So this change in blood sugar and rise in blood sugar plays a part in pain management, is what we're finding in some research. So when we talk about carbohydrates, we can talk about them being either high glycemic index or low glycemic index. So if they're high glycemic index, they're easily broken down, into sugars in the blood. So things like white bread, white potatoes, just white rice, things that don't have a lot of fiber in them, are more simple carbohydrates. They're broken down easily. Whereas whole grains, they're more complex. So they're considered low glycemic index. So they break down a little slower and into sugars. Whole grains have a lot of antioxidants in them too. So they might be a little better for slowing that blood sugar rise and helping manage pain. So one of the supplements people look into a lot is turmeric. It contains 3 different phytochemicals in them. They're listed there. Turmeric, as you can see on the right, is that kind of yellow or orangish spice that's common in like Middle Eastern foods, Indian cuisines, and curcumin's the phytonutrient that gives turmeric its yellow color, and it has most of the antioxidant properties. So it's the one that's studied a pretty good bit. Well, it's been found to have effects like ibuprofen would, so managing pain, really well. Although studies, they failed to show clinical benefit, and that could be for some reasons. Curcumin, the phytochemical, its bioavailability is poor. So that means it's the ability for the body to absorb the nutrient. That's kind of a barrier for, the substance to act on the body. So, there are other forms that might be better absorbed, and, that's kind of what some researchers are also looking into. And there's also some promise in improving symptoms in rheumatoid arthritis and in cancer patients. So it's pretty interesting, that a spice and, can have that effect, or this phytochemical. But, we're still trying to research that. So fiber in inflammation. So if we talk about the digestive system, the intestines, it's estimated that 60 to 70% of the immune system is in the gut. You don't really consider the digestive system as being part of the immune system, but it's really something we're really learning about. There's a whole host of little organisms, bacteria, that kind of help keep us healthy. So that's really interesting. One thing with fiber is what's called prebiotics. They help create and cultivate these good bacteria to help us, absorb nutrients and make nutrients, and help bolster like the immune system. So things like bananas are a really good source of prebiotics. Onions, another good source. So different things out there that really help keep our gut healthy in different ways that you may have not have thought of. And as we talked before, whole grains and high fiber foods mean lower glycemic index. So they're going to raise the blood sugar slower, which, plays a part in helping to manage inflammation. So I just wanted to talk about another supplement, glucosamine. It's kind of another popular topic with pain management. So this is a natural compound found in cartilage. Research on glucosamine is kind of mixed. So looking at a meta-analysis, so looking at a study of a bunch of different studies, they found 3,800 people with osteoarthritis of the hip or knee treated with glucosamine or another substance, or the combination, was no better than the placebo, or like a sugar pill. Another study found that participants actually had worse symptoms. They actually had to stop that study. And then another study did report some improvement in joint pain, but this may have been related to the placebo effect, or this perceived effect that this supplement was helping. So in some people, glucosamine can actually cause, discomfort, GI discomfort, drowsiness, skin reactions, and a headache. So those are all kind of things to consider before, talking with your doctor about a supplement like this, and other supplements. And as always, a healthful diet's important for pain management. So just some more words of caution with supplements. So those are just two of the supplements that are pretty popular in terms of looking at managing inflammation. So, nutrition alone isn't necessarily the cure or, to prevent a disease. And too much of a good thing is not always a good thing. Almost anything can be toxic if you're giving it in high doses. And the body doesn't always use what it takes in. So if you look at, vitamin C, popular around, cold and flu season is, some of these vitamin C supplements to help the immune system. Well, your body might not necessarily be using all that you're taking in. After a certain point, your body eliminates that. So, it's only using so much. Your body is very adaptive to what you're taking in. So that's kind of a, common theme among supplements too. And like I said, like we said before, always talk with your physician before starting a supplement. There could be different interactions with medications, herbal supplements, different things like that. And you might have negative side effects too. And another common theme with supplements too is, nutrition supplements aren't always as effective as eating the whole food. So when you have a whole food, you have, all sorts of nutrients working together in tandem, that play a part together that we don't quite understand, but, we can kind of see in some of these studies. Here's some other tips for managing symptoms of TGCT. For joint inflammation and swelling, we can look at fats. Fats in the diet are helpful in reducing inflammation. Omega-3 fatty acids are helpful in reducing inflammation and arthritis. So these are found in, particularly fish, chia seeds, flax seeds, different things like that. Omega-6 kind of gets a bad rap. It's found in some oils and some nuts, things like that. But it's, it has some link to joint inflammation. But both are important. So we will, mention that. Both are important in the diet to have. But we'll talk a little bit more about those too. And some other foods like apples, berries, onions, ginger, cherries, and turmeric, they contain nutrients that help decrease this activity in the body and can help for, relieving joint inflammation and swelling. Vitamin D is also important. It's shown some benefit in some animal studies. And hydration is important. A study on hydration and pain sensitivity showed that there was increased pain sensitivity when you were dehydrated. So, hydration is important for, kind of cushioning the joints, and, it appears that it could help with pain sensitivity. And as always, healthful diet's important to, manage these symptoms as well. So let's talk about a pro-inflammatory diet. So the definition of this is promoting inflammation or capable of causing inflammation. So this is kind of what we're trying to steer away from. So why are pro-inflammatory diets detrimental? So a lot of times these diets are high in saturated fats. So these are your fats that are solid at room temperature. Think of butter, red meat with, visible fat on the outside, or skin, or, invisible fat, think marbling in a piece of red meat, or high fat dairy. So in some studies in vitro, these are outside of something living, showed that saturated fats play a role in the inflammatory process. It's a number of things that happen. Basically, it says stimulating macrophage production and the secretion of pro-inflammatory cytokines signaling molecules. So it's kind of a chain reaction of things that happen. And in the study in mice, a diet containing about 12% saturated fat, which is comparable to the average American diet, resulted in increased body fat and also increased inflammation markers in the blood. So we kind of briefly touched on omega-3 and omega-6 fatty acids. So the ratio is important. So both are important to consume, like I said. They're both essential. Omega-3 are often considered more anti-inflammatory. Omega-6 fats are the beginning to some signaling molecules, so these eicosanoids that help regulate immune function and are active in the inflammatory process. So omega-6 confusingly can act as anti-inflammatory in some cases, but also part of it can be inflammatory, or pro-inflammatory. So like I said, omega-6 sources are kind of like soybean oil, corn oil, safflower oil, sunflower oil. So if you think of a lot of fried foods, you're going to get a lot of omega-6 fatty acids. And think of, also margarine and salad dressings. So more research is really needed to look at the optimal ratio of how much of each of these fats we really need. But, as a general guideline, eating more omega-3 fats than omega-6 are important. And your omega-3s, remember, are found in fish, they're found in olive oil. And your omega-6 are found in some of these deep frying oils and like nuts and things like that. So another reason the pro-inflammatory diet's detrimental is because it can often be high in sugar. And we already talked about the glycemic index. So sugar, eating sugar, it quickly raises your blood sugar, which in turn, can activate these inflammatory signals and tell the liver to produce, some of these inflammatory markers. So could be doing more harm than good. And also just sugar is, excess calories that can cause weight gain, also considered empty calories. We don't really gain anything from eating sugar other than, the energy, from it, which in turn can cause weight gain and things like that. And another thing about pro-inflammatory diets is they can also be high in processed foods. So on the picture on the right, a lot of your chips and your snack foods, there's a lot of nutrients lost in producing a potato chip, going from a whole potato down to, a deep fried chip. You also, lose phytonutrients. So a lot of those things, like lycopene, like from a tomato going down to ketchup, you lose some nutrients in that processing. And, processed foods have more sodium in them, a lot of simple carbohydrates, ones that are easily broken down, that, raise the blood sugar quickly. And they're often low in fiber, as well as higher in saturated fats or, those omega-6 fats. So here's a question that pretty often is, does dairy cause inflammation? Well, if you look at high-fat dairy, it'll have more saturated fat in it, which we found to be more pro-inflammatory. But dairy with probiotics, so fermented dairy, so think of your yogurt, your kefir, it might actually be beneficial and have anti-inflammatory properties to it. But more research is needed to find out what kind of strains of probiotics are beneficial for us. So another meta-analysis, so just looking at all the studies out there on dairy consumption, they found that of 78 studies, with 52 of them being human studies, that if you ate dairy, you actually saw anti-inflammatory properties, which is interesting. I will say with a confirmed milk allergy, dairy can be pro-inflammatory, so it's the opposite. But and dairy allergy not to be confused with lactose intolerance. The lactose intolerance isn't the immune response. But still, more research overall is needed to find out if dairy and inflammation, have a big role together. But, the research is kind of promising to lean towards it being anti-inflammatory. All right, so let's kind of put it all together and see what an anti-inflammatory diet is. So some popular diets out there are the Mediterranean diet, which has a lot of research backing it. The DASH diet, which is a heart healthy diet. And another one out here, Dr. Andrew Wheel's anti-inflammatory diet. If you Google anti-inflammatory diet, that one might come up too. I will say that one seems to have a lot of rules and a lot of supplements in it. But it's just one of the diets out there. So if we look at the Western diet, the standard diet, it's often considered pro-inflammatory because it's low in fiber. It has empty calories. It's higher in salt, higher in added sugars, higher in fat, particularly saturated fat, and also omega-6 fat. And it also has a lot of processed foods, like you can see with the cheeseburger on the left, which is made of a pumpkin, which is a good anti-inflammatory food. But if you look at Mediterranean diet, this is a diet that's high in fiber, it's high in healthy fats and oils. It has a lot of nutrient-dense foods, so foods that have a lot of benefit to us in a small amount. It's also low in processed foods and low in added sugars and low in saturated fats. So I like this this picture of the Mediterranean diet. I don't know if you remember the old food pyramid, but this is kind of an adaptation from that. So the bottom portion, it's really about your fresh fruits, veggies, whole grains, the healthy oils. These are things that we're eating all the time, in this diet. And if we go up a little more, fish and seafood, these are things that are recommended to eat at least twice a week is what the Mediterranean diet is like. And then as we go up smaller, so these are things that we're eating a little less, a little more moderate in, your poultry, your eggs, your cheese, your dairy. And then up top, we're eating much less is meats and sweets. So those are infrequent. And then on the side, it emphasizes drinking water as the main source for fluid. And then, the Mediterranean diet also has, like red wine, if you're able to drink, in moderation being like one drink for a female and then up to 2 drinks for a man. That, you could see the anti-inflammatory effects with that. And then at the bottom, I like how it, emphasizes, being active and enjoying meals, with friends and family. Those kind of play in part with, nutrition as well, and reducing stress and being active if you can. Those kind of play a role as well. So what does the research say about the Mediterranean diet? Well, one of the studies that looked at kind of a population-based study and clinical studies, they've demonstrated that consuming Mediterranean type diet foods reduces levels of inflammation and markers like CRP, which is one of the markers of inflammation. So here's the what used to be the food pyramid is now called My Plate. So this is just another way to look at, how can you get more antioxidants in your food, in your diet. So if you make half of your plate fruits and vegetables, these are non-starchy vegetables, so like your broccoli or your spinach, carrots, and fruits, that can ensure that you get a lot of antioxidants. A quarter of your plate being grains. If you make half of your grains whole grains, so like brown rice, wheat pasta, whole wheat bread, you get extra benefit of antioxidants and fiber. And then a quarter of your plate being protein, so your lean meats or your plant-based proteins, those kind of fall in between that as well. And then dairy as aside. So here's some more research on fruit and vegetable intake. So they found that fruit and vegetable intake with adults that had the highest consumption of fruit and vegetables. So this is more than 2 servings of fruit and more than 3 servings of vegetables in a day. They had significantly lower levels of inflammation. All these different factors listed here, they were all decreased, and they're markers for, stress on the body. So that's very promising for, eating fruits and vegetables. So, as we said, antioxidants kind of align with different colors. So one tip you could have is, make sure you're eating different colored fruits and different colored vegetables throughout the week. So here's a table. This is pulled from the My Plate website. They have more tips on fruits and vegetables there. Just gives you a kind of a guideline for, how many cups of dark green veggies should you eat in a week, or red and orange vegetables, how many cups should you eat in a week? That way you're varying your nutrients, your vitamins and minerals, but also, as we found out that phytonutrients, those antioxidants, are found in these different colors. So it's important to, like the picture shows, you want your vegetables to be the rainbow, and fruits. So some tips for getting more out of your food. So some cooked veggies actually have more antioxidants in them. So if you're cooking tomatoes, like in a tomato sauce, you're actually getting more of that lycopene out of there. Things like broccoli, when you're cooking that, you actually have more available vitamin C. Carrots, when boiled down, you actually get more vitamin A available. And mushrooms, both cooked and uncooked. Try using a little less water. When you think of cooking like something green in water and you see the water turn green, that's nutrients being lost in the water. So try steaming some veggies. That's one way to, make sure you get a little more nutrients in there. And lowering your cook time. The longer you cook some of these veggies, the more nutrients that could be destroyed. So like some of your B vitamins and vitamin C, if cooked for a longer time, they could start to break down a little more. And, things like olive oil and, other oils, if you eat those with what's called fat soluble vitamins, so your vitamins like A, your vitamin D, E, K, all of these vitamins are better, and also lycopene, are better absorbed in the digestive system if you have a little fat along with them. So if you, roast some carrots, you put some into the digestive system. And one thing to note, should you be concerned or not if you're cooking these vegetables? I don't think it's something to stress over. I think if you're eating the raw vegetable or you're eating it cooked or steamed, you're still getting nutrients from it. It's a good way to have variety. Having something boiled or steamed or baked or roasted, variety is really good for the diet, and just to keep you interested. And another cooking tip. So if you think fried foods, when they reuse cooking oil, it actually darkens over time, when they reuse it, and actually creates, more of an inflammatory oil. So that's one thing to think of. And also, when you grill meats and you get a char on them, or you're roasting meats, the char can also be, a little more inflammatory. Another thing, adding spice, ginger and garlic and, turmeric, adding all these different spices, and fresh herbs. There's a lot of phytonutrients and a lot of antioxidants in it. You can get creative and, get a lot of extra nutrition from those. So, here's some more tips for like increasing fruits and vegetables. So, one thing I like to do a lot is, using frozen fruit and frozen vegetables. They're quick, they're easy, they're, a little more cost effective. They're really shelf stable. They can last a long time in the freezer if, in a Ziploc bag. And they're just easy to toss into different things like stir fries or eggs. You can steam them in the microwave in a microwave safe bowl and maybe like a little covering on there. With a little bit of water, you can actually steam in there. And fruits, they're easy to add in oatmeal, cereal, yogurt. And then, easy to add fruits and vegetables, or veggies in particular to pizza. Also using veggies as chips. So dipping them in guacamole or, different sauces. Eating fruits as a dessert. You can always add, some dark chocolate to the mix. And, get some more antioxidants from that. So like, a piece of chicken or fish atop of like kale or some other veggies. That's another idea to, increase what you're getting from your food. And then, just some other tips for, hydration, like we said, is important for, managing, pain and, just inflammation. Hydration is just important overall. Reducing stress is important. When the body's, actually stressed and the mind's stressed, you're stressing out the body, internally too. And, if you can be physically active, it's important to, get about 30 to 60 minutes of, some activity throughout the day, on most days of the week. So like walking or, a light jog or, a cardio bike or something like that. Those are all ways to, keep the body healthy. Both activity and diet are important. And also to, maintain a healthy weight. Being at a healthy weight is also, more anti-inflammatory for the body. Okay, so I know we went over a lot of information, but there's still a lot about antioxidants that we're still researching. There's a lot of promise with these phytonutrients, a lot of, different nutrients that we're isolating and looking at that we didn't really. Generally, we know fruits and vegetables and whole grain, the why that is still, being looked at to, combating inflammation. So a variety of fruits and vegetables, spanning the rainbow ensures that we get kind of all those nutrients and antioxidants that we need. Aim for whole grains, lean meats, or plant proteins and low-fat dairy. These are all important within a balanced diet. And then things like limiting saturated fats and, a little less omega-6 fats, and especially limiting fried foods is important for an anti-inflammatory diet. And what we found is whole foods in general seem to, have more effect over supplements. We're still looking into different types of like curcumin, like I said, in turmeric, different better absorbed supplements. But overall, the whole food seems to have a different effect than the supplement actually does. Mediterranean diet, it has a lot of promise out there. It's a diet that been consuming for centuries because it's a really generally anti-inflammatory healthful diet. So that's a popular diet that's being researched and has a lot of solid evidence that's out there. Okay, and that's all I had. So we can take some questions now.
Thanks, Kenny. Your feed is cutting out slightly, so I don't know if when you answer, if you want to answer a little slowly, and we'll make sure that the feed is fine. So we've gotten a ton of little different questions,
Okay.
kind of all about similar things you've been talking about now. And so someone asked, what about beetroot and cabbage, those specifically, if getting them daily has any anti-inflammatory benefit?
I don't know about the specifics of beetroot and you said cabbage. You, I think there's a lot of antioxidants in them. I think they're both great to add to the diet, and they have fiber in them as well. So I think they are considered anti-inflammatory. I don't know about like a specific like supplement for those. I would have to look into that a little more.
Okay. And then someone also had said that they heard that nightshades like tomatoes and peppers are bad for inflammation. You had mentioned that they are good for inflammation. Can you give more information?
Yeah, I mean, I think both of those have antioxidants in them. I don't know of any specific, research saying that they're, inflammatory. I think they're both overall part of a generally healthy diet to include those. So I wouldn't, I don't know of anything that says against that overall.
Okay. And then so there's foods, especially processed foods, have hormones or GMOs in them. Would that also increase inflammation? Or have you seen that increase inflammation?
No, so I know there's a lot of concern with like hormones in, particularly like dairy products and like meats and stuff. But the evidence out there is that they're, generally safe to consume. The amounts of hormones in those are, you pale in comparison to, what's the hormones in the body. So, they're, safe to consume. And I know GMO foods or genetically modified organisms, they get a lot of bad rap too. And those are safe too to consume. Um, you know, um, so as long as you're looking at getting the fruits and vegetables in your diet, I don't think it's a big concern to be concerned whether it's non-GMO or GMO.
Thanks, that's great. So someone also put that they were surprised to see popcorn in your photo of highly processed food. Do you consider popcorn with low salt, no butter? Would you consider that still in that group?
So I kind of noticed that when I was talking today, and also nuts were on there. So they're not really considered processed foods. So they kind of snuck in the picture there. But yeah, no, popcorn's, I eat popcorn as a good snack. It's, with not much butter and not much salt. You can use some other seasoning on there. That's a good snack and actually a whole grain. So it kind of popped up in the picture there.
So you provided many resources throughout your presentation and a lot of citations. Do you have a favorite source that you get good quality information that's supported by science on anti-inflammatory versus pro-inflammatory foods?
Yeah, so you can often, if you have a particular nutrient that you want to look into, if you type dietitian next to it, you can often get, quality information. Because as a dietitian, I'm certified to maintain, talking about research and talking about what's true. So, to maintain my licensure, I need to keep that up. So if you find a source with a dietitian on there, it should be quality information. You can go to, the Academy of Nutrition and Dietetics. It's the credentialing for my profession. They have good information on there. Those are kind of some good, sources. And, like the USDA, the government website, with My Plate, if you search My Plate, there's a lot of good evidence-based, information on there about anti-inflammatory diets.
So someone also asked about like collagen supplements for joint health. Do you know much about, I know glucosamine is a type of collagen supplement as well, right?
Yep.
And then as well as like caffeine's role in joint inflammation.
Yeah, I don't know a whole lot about, like a caffeine supplement and joint inflammation. You know, sources of caffeine, if you look at like coffee and like chocolate, they have caffeine in them, but they also have anti-inflammatory effects. So that, may counteract anything like that, but I don't know specifically taking it for, managing inflammatory effects.
But you wouldn't say that they have necessarily like negative effects.
I wouldn't say so. Not that I'm aware of.
Okay, then as well as, so some people have asked about like canning and using cans to hold either liquids or foods, and whether the chemicals from the like aluminum would leach into food at all. Do you know of any cases in which that happens?
No, I don't really know of anything like that. Generally, canned foods, it's a good way that you can get like extra vegetables in your diet. Again, like frozen foods, they're shelf stable. Canned beans, they're a good source of antioxidants. And they're, really quick and easy. So they're, really safe for us to consume. And also just another way that you can get, vegetables in your diet.
Perfect, thanks. Would you mind, while we still have time, mentioning anything about the keto diet and that trend as well?
Yeah, so that's definitely a popular diet that's out there. And it's really one of the groups that it's really beneficial for is, in like epilepsy. It's, there's a lot of research showing that a keto diet can pretty much eliminate like epilepsy in like children. So that's kind of the big diet that, strongly supports the keto diet. There's research out there looking at other disease states and the keto diet, but, evidence isn't quite strong for it. And like any other diet, you could have a good quality diet and you could also have, poor quality diet. So a keto diet that's high in, processed meats and red meats, things like that, that wouldn't necessarily be good for inflammation. Whereas, if it gets you to eat more, plants and less processed foods, sure, you'll have some benefit with that. But, you know, a diet that eliminates, maybe eliminates some food groups, you might be missing out on some nutrition there. So, it's kind of one of those diets that, you should kind of seek like a dietitian or like, a doctor and, kind of work at it through that so you're not missing anything. But, there isn't any research to kind of support it yet for, other disease states. So I don't really recommend that one.
Is there a such thing, we've talked about all the different type of diets and the fads that go with them. Is there a such thing as an anti-cancer diet?
So an anti-cancer diet, so there isn't specifically one, but I would say, like Mediterranean diet, that's, it's a diet with a lot of anti-inflammatory effects. So it's, good at combating that inflammation. But, it's not a cure for cancer. It's not a cure for disease. But, we're finding out that it's, it's beneficial for managing inflammation. So that's any diet that has a lot more emphasis on, whole grains and emphasis on, good fats and a lot of fruits and vegetables, would be beneficial for that.
Perfect. Yeah, that was a great answer.
These are
So
great
all in all,
questions.
so yeah, so I guess we'll end on this last question, unless anyone else has any more that they want to send in for the last few minutes. Is so you talked about food being a treatment, but not necessarily a cure. Can you
Mhm.
talk more about maybe why food has not been implicated as a cure for certain like tumor diseases yet?
Mhm. Yeah, so I mean, so a diet is, this whole orchestration between all these nutrients kind of working together. So, it's hard to kind of pinpoint, one thing and say it's, associated, with, some of these diseases, and especially curing a tumor. So it's really complicated to kind of make that correlation between the two. So really, it's you can't say that food is a cure better than medicine. I know the sayings out there, let food be thy medicine. Well, that's a little misleading. And dietitians will say that food isn't medicine. But it's kind of one piece of the puzzle to kind of help manage a tumor, or managing cancer or disease.
Well, thank you so much for your time, Kenny, and thank you everyone for coming. Have a good rest of your night.
Great. Thank you everyone for joining.